hypermobility isn't just flexibility. In fact, some people don't even have flexibility with hypermobility, although some people do, because it's actually something that affects your connective tissue. And even though there is a few types that are more well known, like hypermobile Ehlers-Danlos syndrome, other types of Ehlers-Danlos syndrome, or hypermobile spectrum disorders, people still think that HSD is actually less severe than hypermobile EDS. And so some people go their whole lives without any diagnosis because they just didn't fit one little box on a piece of paper, even though HSD and HEDS should be treated exactly the same, because even if you have one and not the other, you can still have really, really severe symptoms and it affects your whole body. And then people think it's all in their head because they also have dysautonomia, but that looks like anxiety on paper and on labs and like tests, but it's actually not. But then you get anxiety also because you are being told that it's all in your head, but you have symptoms everywhere and you don't know what's going on and you can't get any answers and it's frustrating. So then you try to do yoga because that's what everyone says you should do, and then you overstretch your hamstring and then you can't move, and then you twisted your ankle on the way out of class, and it just feels sometimes helpless. But there is help and there are supportive health professionals out there. It's just hard to find. So sometimes you have to go to the internet, but then you can find some people. And yeah. Who said that?